Hafide Zentiro. We are at the CHCC dental office with the chief dentist for CHCC, Dr. Angelica Sabino. Thanks so much, Dr. Sabino, for joining us.
Thank you for having me.
And so we're chatting because a few weeks ago we did a story on the new public law that went into effect requiring labeling of betel nut
Correct.
at stores. And there were a few questions about how that could lead to oral cancer. And you're a dentist, and so you see these, I don't know if it's on a daily basis, but can you just tell us how the nut itself can cause oral cancer?
Well, recent studies that I have looked into has shown that the reca nut, that's what we call betel nut or boo, also has carcinogenic properties. It's not just the cigarette that you put into, but the nut itself as well. I haven't really, really looked more into it, in depth into it, but that's the latest studies that I have done.
Right, and I understand that's also why there was the effort for the whole labeling process,
Correct.
so people are informed. Because some people were saying, "Oh, it's the tobacco," but you're saying the nut itself is also
Correct. So that's the recent studies that they've produced out that the nut itself is also carcinogenic. So when I go and make my presentation, I explain that when you add a couple of carcinogenic items to a product, it becomes more potent. It becomes more that the potential of being, having cancer is greater. And I did Venn diagrams to show them, like if you're a chewer, if you're a tobacco, if you drink a lot of alcohol and, certain factors, you will have a greater potential of getting oral cancer. And also, you talk about families here in the CNMI where you have people with oral cancer, why it seems like the siblings have it, because just like any cancer, when it runs in the family, you have that gene, so you have a greater potential of having cancer. So if you don't listen or if you add habits that have carcinogenic properties, the chances are of having oral cancer increases. Does that make sense?
Yes, it does. Thanks for explaining that, Doc. And I also just wanted to ask you what you're seeing on the ground here at the NMI's only hospital. How many cases, or how often are you treating oral cancer?
It varies because I noticed that in 2021 and 2023 we had a higher incidence of the number of oral cancer casualties. Patients die from oral cancer. So it be dependent on any given day. I don't know because it always fluctuates. Like in January of this year, I had more people that we recognized and diagnosed and came out positive having oral cancer. For the month of September, there was nothing, So it's very hard to say, hey, 3 comes in every month. Really, it fluctuates. But the great thing about we have a program with all the dental clinic here in the CNMI that you can ask for free oral cancer screening. And I always tell my patient you have to ask for oral cancer screening because that's just a screening. That they don't talk about what's the condition of your teeth, but really to look in your mouth and look at your soft tissues to see if there are any lesions, and then from there you can proceed on. And I always open the doors. I always open to anyone that wants to come in. And even if I don't find anything, I can say, if you feel like you're afraid, just come on, make an appointment because, we'll just take you in as soon as we can.
And so emphasis on free, you can just call
Correct.
and schedule a free
You have to ask for a screening, oral cancer screening.
Okay.
And even though we're in a consortium with most of the dental clinics in Saipan.
Yeah.
So you just call them and say, hey, do you offer free oral cancer screening? And then, it can be people that chew a lot, people that don't chew, but don't expect them to look at your teeth, but they will look at your mucosa. It takes about 5 minutes for them to do that. Yeah.
And maybe if you're sitting at home and you're watching this, what are some signs maybe that, of course, you would want to go to the screening,
Right.
But what should you be looking for?
Well, I always tell people that if they see any sores in their mouth, like any lesions, that doesn't go away for 2 weeks. Because I said, if you burn your mouth, like you eat a pizza, you'll have a sore. Or a lot of times when you're sick, you have sores in your mouth. It seems to be the trick is the 2 week period. If it doesn't go away after 2 weeks, then you come and take a look. It's also swelling that doesn't go away, but you just need to have it seen. Things that concern you, that you look in your mouth and you've never seen it there before, you know. You just go to the dentist to make sure that it's not an anomaly, you know,
Yeah.
and it's not concerning.
And are there any kind of difficulties right now in terms of the outreach and education? Are you seeing people come in more? How's it changed since you've started here at CCC?
Well, we try to educate the public. You still have a lot of local myths, like, you know, you don't go and have it touched because it's going to get worse, or, you know, it's not really true. You know, they're in denial, you know, that, you know, my grandma chewed before and they're okay. Well, we have more cancer now, right? We have more GMO, you know, genetically
food,
modified in our food, in our drink, in everything, you know, even our plants, you know, you'll see they'll say that that's a genetically modified plant, you know. So there's more cancer nowadays, maybe because we're seeing them more, you know, we have more vision, you can see it more before we don't look in people's mouth, you know. So that's false. That is false. To say that it does not cause cancer, there's a big correlation. I mean, you know, 1 + 1 is 2. You know, someone comes in and they're chewers and they have this cancer in their mouth. Where do you think it comes from, right? You cannot come up with anything. That's basically the common denominator in a lot of them. And unfortunately, before I came here in 2016, I had not seen oral cancer, not a single one in the States. I had to learn, you know, to be able to be specific, you know, just by looking about it, like you can already discern which one is troubling and which one is not. But and a lot of the dentists that come, even the physicians, even the ear doctors, they're shocked because these are things that are really common and unique to the islands. You know, we see it in Guam. I see it here a lot. I see it in the islands that predominantly high chewers. They talk about it in other countries like Taiwan that chews billion, you know, and also in certain parts of India.
And Doc, perhaps this is a hard question, but what's your advice to someone who says, you know, it's part of our culture, I want to chew no matter what? Is there a way, like, what's your advice to them? I mean,
the thing is that everyone is stubborn, right?
Right.
You can encourage them, but you cannot force them, right? And I'm from Palau, so it is part of my culture. But, you know, you have to choose. You know, we have a lot of culture, and you choose whether you're in a culture of death or a culture that makes life and, you know, so forth. You know, we have a culture before that they practice witchcraft and stuff. You know, we don't do that now. I mean, it's kind of those things, right? And it's very addictive, don't get me wrong, especially when you put tobacco into that component. You have people that smoke and they have a hard time smoking, right? There's that addictive component. I have patients that, you know, they say, until you find something, I will continue to chew. And unfortunately, that's a very wrong way to see it, because when I find something, it not only, it's a suffering for the person themselves, but the whole family, right? You're not talking about only the immediate family, you're talking about the whole family. You know, the whole island family, the whole community, the friends. It affects everybody socioeconomically, because you see them, they have to go to the States, and you see people out on the street begging for money, doing all these fundraisers, all of them for this treatment, right? And when they come back, how is their life, right? Depending on how they're treated, many of them comes back disfigured, right? So now you have the mental anguish that's associated with this cancer, right? And people don't understand that if you ask someone that's living it, they would say, I wish I wasn't stubborn, because now they're having a hard time talking. They're in constant pain, right? Is that?
yes. Thanks so much, Doc. Thanks so much for taking time to speak with me to educate the community and myself too. I'm learning about this as well, and appreciate your time. Thank you.
Thank you.